Good afternoon, everybody. Welcome to the groundbreaking moment in education. We at upGrad are very proud to present to you the upGrad Institute of Medical Sciences, which is our university marking our first foray into the realm of medical education. As you all know that upGrad has a learner base of around 7.7 million learners, and we are South Asia's largest higher education provider. So upGrad was our major forte and major USP was into STEM courses and management courses. We have n number of university partners. Like to name a few, if I would start, we have Deakin, we specialize into degrees, into degrees like masters, doctors, bachelors. So basically to add to upGrad, we now, being a global learning engine, we rest on 4 pillars. First is the large repository of original and own content and IP. The second, if it's our own best-in-class proprietary tech platform that we are. The third is that we have a high-tech human-led delivery service backed by coaches and mentors. And the fourth is an 85% completion track record backed by a further 80% career outcomes guaranteed performances. Keeping all of this in mind, we have now entered into the foray of medical education. So one of our institutes that we have in Vanuatu is our first entry into the medical education. So UIMS, which is upGrad Institute of Medical Sciences, stands as a beacon of excellence, nestled in the breathtaking city of Port Vila. Its mission is clear: to provide aspiring medical professionals like you with top-tier education that sets new standards. So UIMS programs includes the Global MD and the Bachelor of Medicine, Bachelor of Surgery program, which offers a transformative learning experience. So joining us are esteemed guest speakers who bring unparalleled expertise to this virtual stage. Dr. Vivek Lal, the Dean of UIMS, is a highly respected figure in the medical community with over 3 decades of experience in clinical medicine, academics, and administration. His profound knowledge and dedication to medical education have shaped countless careers. We are also honored to have Dev Tirth Banerjee, the Executive Director of upGrad Medical Education with us. With a remarkable background spanning multiple industries, including education and healthcare, Dev Tirth has a proven track record of success in building high-performance teams and driving growth strategies. This webinar is a golden opportunity for all of you here to explore the future of medical education and witness the first-hand the unique offering of upGrad's maiden venture into the medical field. Whether you aspire to become a doctor or are passionate about the limitless possibilities of medicine, this event is designed to captivate and inspire learners interested in medicine. Get ready to embark on a remarkable journey as we uncover the upGrad Institute of Medical Sciences and discover a world of excellence, innovation, and boundless opportunities in medical education. Welcome to a new era of learning. Welcome to the upGrad Institute of Medical Sciences. So, learners, without taking a moment here, I would welcome Dr. Vivek Lal to please take the stage and talk a little bit more about our new initiative that upGrad is taking and introduce us and walk us through what is upGrad Institute of Medical Sciences. So over to you, sir.
Sure. Thank you so much, Harshita, for the introduction also. So welcome viewers, and I think I've already been introduced as a dean of this institution here in Vanuatu. Vanuatu is a beautiful country here, which is exactly in between Fiji Islands and Australia. And the location is really scenic, very idyllic location. And it's a beautiful place, to start this very, very excellent venture of upGrad. So just to give you a very brief overview of the programs that we are running here, we'll be running 2 programs. The 5.5 years MBBS program, which is aligned with the NMC guidelines, and we'll be following the curriculum of All India Institute of Medical Sciences. So this will be the first program, the Indian MBBS, and the second program will be a Global MD program, which will be aligned with the USMLE. And this is This is the program which is practiced in most of the offshore medical schools in, which are aligned to the USMLE program in USA and also in the Caribbean islands. So these the details will be, in fact, later on, Mr. Dev will also share with you. And the eligibility for these two programs, I'll just very briefly outline what is the eligibility for these two programs. For the MBBS program,
before
we'll
be, Dr. Lal, sorry for interrupting you. Just
No
before
problem.
we go to the eligibility, I was just curious to know from you that you mentioned that the other program name is Global MD. So MD is generally referred as a master's course, right, in India?
Yeah,
but
exactly.
Both of these courses are undergraduate courses, right? So
Yes,
what is
exactly.
So what is the rationale behind this?
I think it's a very relevant question because in India, we confuse the Doctor of Medicine as a post-graduation, or you can say the specialization. Whereas in the Global MD, the MD means it's again an undergraduate program. And once you graduate from it, you are again just a medical graduate. You're not a postgraduate. So good that you brought it out, Harshita. And so even when you do the Global MD program, it is basically a undergraduate program and you come out with your graduate degree, which is known as a Global MD.
So basically it's just a nomenclature.
Yeah, exactly. So there is a difference in the nomenclature and nobody should get confused that the Global MD will give you a postgraduate degree. So that's a very relevant thing that the viewers should understand.
Great.
So if there are no further questions on this, then I can probably go over to the eligibility criteria. So coming to the Indian MBBS, the most important thing that we are following here is that the person should be NEET qualified. So that is number one, and number two, he or she should have at least 50% marks in his 10+2, his or her 10+2, and these 50% marks should be individually in physics, chemistry, and biology, because these three subjects are mandatory, and they should also have a 50% aggregate in all. So that is the eligibility criteria for our MBBS, and they should be NEET qualified. And as far as the Global MD program is concerned, here NEET is not mandatory, but they will have to undergo a written examination, which will be conducted by us. And they have to qualify this written examination, and only then they will become eligible for the Global MD program. And that too, it goes without saying that the person has to clear the 10+2 with that basic percentage of marks. And another very important thing which I must mention here is that when you come for the Global MD program, anybody who is 10+2 cannot straight away join the MD program. He has to go through something which is known as a pre-MD. So there is a pre-medical program for 2 years, or you can say 4 semesters. And once he or she clears that pre-MD, then only they can come to the MD. So the total duration for the Global MD will be 6 years, whereas the total duration for the MBBS should be 5.5 years, which will include 1 year of compulsory rotatory internship. Now, when we talk of the MBBS program, the internship will be provided here only in Port Vila, because that is a very mandatory guideline by NMC. That if wherever you are doing the Indian MBBS, the internship has to be in the same country. And we are following all the NMC guidelines in letter and spirit. So the internship will be provided here only in the Villa Central Hospital in Vanuatu. Whereas for the Global MD program, we can do it here also, and we can do it in any other countries in different super specialty hospitals where we will be having different tie-ups, different agreements with them.
Yeah. So, sir, as far as I have understood, we are open for both kind of students, not only students who have qualified NEET, but we have options for learners. Like, they should not get disappointed. We have a great option for them as well. We have a Global MD program.
Exactly. So anybody, who was probably, he was unfortunate or could not clear the NEET, then definitely we have the Global MD program.
Great. So I would also like to understand from you, sir, from your experience, like, learners, any learner who is in, if I talk about India, their first priority is that I should qualify NEET and I should pursue my MBBS from India itself. But now there are a lot of, we have been reading over like gazettes that are issued by National Medical Commission. So there are a lot of guidelines mentioned on the after the introduction of next exam, that you won't be able to qualify next step 1 if you have not qualified next step 1, you won't be eligible you don't get license to practice degree, right? So I just wanted to understand from you. So there will be many learners who will be aspiring to be a foreign medical graduate and who would aspire to pursue their MBBS and the Global MD program, which is also an undergraduate program from abroad. So what is the competitive advantage, like, or if you can say that, what are the benefits if I am a learner? Why should I, in terms of infrastructure or in terms of international resources, like why, or the state of the art, like why should I aspire to for a foreign medical graduate? Yeah.
See, I think that this is again a very relevant question that you have asked, because when you are in India and when you are pursuing an undergraduate program in India, you're basically targeting only India. So once you are through, and now even for an Indian Indian medical graduate, you have to give the next exam. So you cannot, you are, once you are through with your graduation, even then you will have to pass the next examination. When you come to a foreign nation and when you come to a reputed medical school, you are eligible to practice in India also once you clear the next examination, and the entire world is open to you. You can practice in US, you can practice in Australia, in UK, Europe, New Zealand, anywhere. And even if you are doing your program here in Vanuatu, we already have an arrangement with the government that the person can practice here also in Vanuatu without giving any next examination. So the outreach, you can say your scope is much wider if you are a foreign medical graduate as compared to an Indian graduate. And then when you talk because I think you mentioned the word infrastructure also. So when you talk of I will not comment on any other school, but when you talk of our infrastructure, it will be of global standards that I am personally guaranteeing. So whatever infrastructure we have, whether it's the classrooms or the laboratories or the equipment that we are using for the training or the faculty that we are using, for training our students, that will be world class. And our faculty will not be restricted to India. It will be an international faculty from almost, you can say a lot of nations from not only in Asia, also Australia, US, Europe, Middle East. So we'll be having an international faculty with us. So definitely the training standards will be global.
Great. That's an amazing opportunity. And it's really good to hear that firstly, we are not only restricted to the learners who have qualified NEET. We have an option for learners who have not qualified NEET. They should not get disappointed. Secondly, even if you have qualified NEET, still you should not be dependent upon that. If I'm not qualifying next step 1, then my life is over, or now again I have to start from scratch. You at least get a license to practice from Vanuatu. So that is what kind of initiative that upGrad is taking and our institute is taking. You are mentioning, sir, about the faculties. So we would love to know more about the faculties as well. So either Dave or you, if anyone can walk us through the faculties.
Sure.
That would be great.
Let me start the discussion, and Mr. Dev definitely is going to take over, and he'll give you lots of very important details about the institution. So when we talk of faculty, we have some guidelines, we have some parameters. So again, there are 2 types of faculty that we will be having. One will be the full-time faculty who will be taking the classes here on campus, and we will also have an adjunct faculty. Now, these adjunct faculty that we've already selected, and they are already on our rolls, are very, very reputed super specialist doctors all over the world. So they are from India also, they are from Australia, they are from US, they are from Middle East. And these are super specialists who have got, say, almost you can say 15 to 25 years of experience in their specialty. So we will be having guest lectures from them. They may be online, and then probably they will also come on campus and give some lectures here. So, that is the adjunct faculty. And as far as the full-time faculty is concerned, for a full professor, the candidate or the professor will be having more than 15 years of teaching experience, and that too not only in India, it will be in international schools. So they'll be, and we will be, we are selecting those faculty members who have experience in the Indian MBBS curriculum also, and also in the global MD, or maybe even in the UK MBBS, or in Mauritius or in Middle East. So, and also they may be having some good experience in PBL kind of curriculum. So the faculty that we are recruiting are highly experienced, not only in the traditional curriculum, but also in the different types of curricula which are being followed all over the world, international. So that we are, I am personally supervising this.
Okay, great. Good to hear that, sir. So one of the questions that I would like to ask here is, so when considering for pursuing an MBBS degree, what factors should prospective students take into account to determine which program is better suited to their needs, such as curriculum, faculty expertise, clinical exposure, or international recognition? So which kind of factors do you feel play a very major role?
To answer it very simply, if a student is there and he kind of he prefers to work in India, or he prefers to work in the Indian subcontinent, then I think he should go for the MBBS program. But definitely, if a candidate is more interested in going global, maybe exploring new options in countries, or maybe they want to explore different, or you can say a slightly non-traditional approach in clinical medicine, then I think they can go for the MD program also. So see, one must not confuse that probably MBBS is better or the global MD. No, both are the same. Basically you are becoming a doctor. You're becoming a medical doctor after clearing your MBBS or MD. Only thing is, what is your overall goal? What is your long-term goal? So this decision whether to go for the MBBS program or for the MD program is basically an individual choice. I will not say that this is better or that is better. It's basically an individual choice.
Great. So thank you, sir, for highlighting this and walking us through that. One more question, sir. So for individuals who graduate with a medical degree from a global institution like upGrad Institute of Medical Sciences in this case, are they eligible to pursue postgraduate studies or residency programs in India?
Means you're the MBBS or the MD?
MD. Like
if I'm a
yeah.
Absolutely.
Both of these programs.
Absolutely.
Yeah.
See, as per the NMC guidelines, even if you are a foreign medical graduate, once you clear your next examination and you get a license to practice in India, you can always go for a post-graduation in India. You can first do your MD, then you can do your DM, or you can become a fellow in a surgical specialty. So that is absolutely fine. So once you clear your NEET examination and you get a medical license to practice in India, you can definitely follow a post-graduation program in India. There's no problem at all.
And sir, what about global MD program? If I am pursuing, because I think after global MD, the learners basically will go for USMLE program, USMLE 1 and 2. So can they, if they want to come back to India, can they come back to India and practice in India first? And second, can they pursue further studies and residency in India?
In fact, that is what I was telling you, that say if they clear the USMLE, definitely they can go and practice in US. And once you are practicing in US, and if you practice for about 1 year in US, you can also apply for a registration in Australia or even in Europe. So you get a global kind of scope for you. That is one. And if you are doing a global MD from us, and if you want to go and practice in India, as I said, you have to just clear the next examination, that exit examination. Even if you are a foreign medical graduate.
If I may just intervene here, Doctor, I'm sorry to interrupt.
Yeah, please.
I will just, I just wanted to put a little bit light on the pathway of global MD, because that seems to be the question. MBBS is quite simple. You complete your 4.5 years of MBBS, you write next one, then you do your 1 year of internship in Vanuatu, and then you go back, write next 2, you register in India, you practice in India. It is like any other college in India. It is just happening in Vanuatu, and we are following the NEET guidelines. When we come to the global MD program, it is the objective is to clear USMLE, US licensure exam, and practice in US and other countries, some 50 odd other countries which accept USMLE directly. The countries in the list would be US, Canada, New Zealand, many countries in Europe, or most countries in Middle East. Australia allows you to write the AMC exam if you have cleared USMLE or you have passed from an ECFMG approved college. So, but they have a different examination. So the students who come to global MD, they should basically have a pathway in mind to first practice for certain years outside, especially in one of the countries like US, Canada, UK, New Zealand, and Australia. What the current NMC rule says, and let me caution you that this is a little bit of a gray area because NMC changes every day. But let me bring you up to date on this. If you do global MD program and you have cleared USMLE 2, which is the objective of this program, you can apply for your residency in countries like US, Canada, Australia, New Zealand, and other countries which accept USMLE. Once you have done your residency, and your residency can be 2 years, 3 years, 4 years, 5 years, depending on what specialization you are pursuing. Let us say your residency is of 2 years. After you complete your residency, you write USMLE 3. Once you have got a USMLE 3, you are a full-fledged registered doctor in US and recognized doctor in any of the countries which accept USMLE. What NMC rule says that if you have completed USMLE 3, that is residency in US or any other country, and you have done your USMLE 3, and then you can come to India and register as a doctor. Whether you have to write next or not, it is not very clear right now. Earlier, before this next thing happened, you didn't have to write FMG. You can directly register if you have done your residency from one of the 5 countries, US, Australia, New Zealand, Canada, and UK. This is right now the update on this. So to answer the question very simply, yes, there is a pathway back to India after global MD. It will take a little more time than the MBBS. After MBBS, you can come directly, write next exam and practice. After MD, you have to practice, you do residency outside, maybe complete your specialization, and only then you can come back and register to India. This is going under a lot of iterations, and it is very surprising that India right now directly doesn't accept something like USMLE, which is accepted universally. So this may change by the time this batch starts and comes out. So this is the overall picture as of today. And another thing that I wanted to tell students who want to pursue global MD, that your purpose is mostly to go outside, settle outside, practice outside India. Those are the ones who should really pursue global MD. And there are a lot of big and good career opportunities across developed or developing nations all around the world. Even US doesn't have enough doctors. Australia has a big gap in physicians. Countries like New Zealand, Australia, Indonesia, the Philippines, countries in Middle East, everyone needs healthcare practitioners and doctors, general physicians, specialists. So once you have done your global MD, you have got your USMLE 2, the world is your playground.
Yeah. So even I was reading the Gazette a few days back, and I've been like very closely following the gazettes issued by National Medical Commission. Like this year, I think within 6-7 months, they have issued more than 3-4 gazettes, and with all together different guidelines. So I was just thinking that MBBS is still like a gray area, that we don't know that what further guidelines will be issued. So learners were very curious, and I can see the questions in the Q&A box related to the global MD program and what kind of opportunities that the learners would get to see, and what kind of resources, like how upGrad Institute of Medical Sciences in Vanuatu, we will support our learners who are interested for the USMLE exam, and how can we help them prepare for the USMLE exam, 1, and 2, like I understand that this is a 6 years program as mentioned by Dr. Lal, and he said that initially we'll have a 2 years pre-medicine, and then it will be followed by studies, and then 2 years clinical rotation. So these 2 years clinical rotations will be like in India, not India, absolutely. It will be in Canada, US, wherever. Like, how is upGrad UIMS helping these learners? Yeah.
So just let me again intervene here. Sorry, Doctor. It's
No,
just that I
please.
have to correct something. That 2 years of clinical rotation can be anywhere,
Yes.
which is where the hospital is a specialty or multi-speciality hospital and following the norms of ECFMG. No problem. It can be India, it can be Middle East, it can be Europe, it can be obviously the primary targets would be US, Canada, Australia, New Zealand. And what we are doing is right now we are going through a process. We are in our, so guys, let's be very honest, we are in our first year right now. Our first batch is going to start. So we are going through a lot of developmental procedures right now. But you can be rest assured that upGrad, which is one of the best and biggest higher education company in the world right now, is behind this project, and the future of this project will always keep getting better. So we are right now going through the process of tying up with hospitals across the world, including Australia, New Zealand, Malaysia, Singapore, even India and Middle East. We will start the process of tying up with hospitals in US after 1 year of completion, because that is a requirement for hospitals there. And by the time the first batch of MD gets eligible for their their clinical rotations, it will be anywhere between 2026 to 2027, and we will have a substantial repertoire of hospitals to choose from. And the clinical rotations will be provided by us, by the college, because it is still very much part of the program and will be monitored and followed and completely end-to-end managed by the college, because you're still our students and you're still gathering credits, you're still doing the coursework. Once your clinicals are finished, you have prepared for USMLE 2 and you have passed USMLE 2, that is where we hand you, our program is over, you get the degree. And even then we assist you for applying for your residencies across the world and going for your residency in one of your chosen countries. Dr. Lal, if you want to add anything.
Yeah. In fact, the question was on, I think, USMLE training also. So, when you are going through the MD program, the global MD program, the classes are taken in such a way that they prepare you for the USMLE step 1 initially. So, our curriculum is set in such a way that you will not need a separate kind of coaching for your USMLE. Your curriculum itself and your classes itself, they will prepare you for the USMLE also. And in case we feel that students are having, or say they are doing some mock tests and they are having some problem in the questions and all, then we can even provide a separate kind of a coaching for such students who are facing a problem with the mock questions. But otherwise, once you are doing your MD program, automatically you are getting prepared for the USMLE.
Yeah. So I think there are quite a bit of questions here. Instead of we doing our one-way communication, let's see what some of the participants are asking.
So I am asking questions. Yeah. So I'm taking these questions from the Q&A only, the kind of questions that we are getting. Yeah. And
let's name some people and try and answer their questions where we know who is asking. So we have one question off the bat I want to answer is somebody, Ishtha has asked the question. The university is not registered with the World Directory of Medical Schools. Right now, our registration with ECFMG is under process. Yes. It is an ongoing process. It doesn't happen just like that. So certain milestones we have to meet as a college, and the registration happens accordingly. So once ECFMG registration happens, it will get listed in WDOMS as well. The timeline for it is about somewhere between September, October. You should start being able to see the college in WDOMS. The process is ongoing. Another question which we have is how much NEET score for qualifying to the Indian MBBS program, which follows AIM curriculum. AIM's curriculum, see, we follow the same rules as any other Indian college in that regard. So once you apply, once you share your NEET scores with us, we will be able to tell you whether you qualify for obviously it has to be a qualified NEET score, and then we will be able to tell you whether you are able to secure a seat on basis of that score. Once we have gone through a bit of the application process, I will encourage you to apply definitely if you have a qualified NEET score, and we will take it forward from there. Then we have a question. Okay, this is a generic question and a very good question which many people have. Do Indian students studying in Indian MBBS colleges also have to write next? Yes, that is right. Earlier till 2023, the students who are passing out from Indian colleges did not have to write any exam. They would go into direct registration, while the foreign medical graduates had to take the FMG exam. From this year, it's going to be different. from 2024, whoever passes out from even Indian colleges will have to take a licensure exam. So essentially, medical registration in India has become like legal registration. Everybody has to take an exam. Doesn't matter where you are passing out from.
Exactly.
Then there is how can we pursue MBBS in US or Canada? So to begin with, the MBBS parlance is not used in US and Canada. The US, the system is a little different. So there in US or Canada, you have to first clear your A levels, which is equivalent to our +2. Then you have to do your graduation, which is a 4-year graduation. And you have to ensure in your graduation, you have biosciences, a pre-medical component. Once you have completed your graduation, you go for the 4-year MD program, the same program which we are offering here. So that is the pathway. So for that, once you have cleared your +2 from India, you have to take your A-level exams, and you also have to write MCAT. You have to do you have to ensure you're doing a 4-year graduation with biosciences, and then you have to write MCAT to get entry to the MD program. If you want to directly pursue it from US, we are providing an alternative to that, that after +2, you come do your pre-med with us, which covers your biosciences part, and then you directly go into the 4-year MD program. Then we are talking about, do the Indian students from Indian MBBS colleges have to write next to study MD? If I choose, so this is, I believe you're talking about the postgraduate MD here. Yes, if you are an Indian graduate and you have to do a postgraduate MD from India, you have to write next PG. Whatever I'm interested in going to.
Dave, one question was related to like it's quite linking to the after the eligibility class 12. So they're asking, is there any age limit for applying to both of these courses?
Oh yes, that's a very good question. I've got question. Can study at 45, and also what is the age limit? To address that, no, there is no age limit. So till last year again, MCI and NMC had an age limit, but from this year all age limits have been removed. So you again, for the India program, you have to write NEET, qualify NEET, and come and join the program. And as far as the Global MD program is concerned, you can directly apply and write our exam. And if you are selected, you can go for the program. Age is not a limit as of now.
Not a bar.
Yep. Okay, so I think a couple of people have requested to speak, but I think we may have a little bit of time constraint, because I also wanted to show you a little bit about our college. So let me do that in the next quick 10 minutes. I'll run through some slides so that you actually see what is happening here. And then if we have time, we'll take more. We will definitely take more questions. I would want interaction as much as possible. And please keep putting your questions on chat so that we can pick up some questions and we can answer. And then if we still have some time, we'll pick some people to talk. So let me quickly share my screen. And while I thank Dean for all the information and wisdom that he has shared overall in how to pursue a medical college, I would like to take you guys through a journey which is more specific to our college. And let me tell you, me and Dean right now, we are in Vanuatu. Presently, we are coming to you from there, which is about 5.5 hours ahead of India time, and part of in middle of the South Pacific Ocean, very close to Australia, New Zealand, and Fiji. So let's start off with the presentation, and then we can always come back to the question and answer sessions. Okay. Great. So yeah, welcome to upGrad Institute of Medical Sciences again, guys. The thought behind it is to redefine medical education, take medical education to the next step into the future. Why and how, I will tell you. First, let me tell you about the city, the beautiful city right now we are in. It's called Port Vila, and it's a very popular holiday destination in the South Pacific. People from Australia, New Zealand, Southeast Asia, even US come a lot to this country and to this city to enjoy the natural beauty, beautiful beaches, and the coastal lifestyle. Port Vila is the capital of Vanuatu. The population is around 50 to 60,000 people. Overall, Vanuatu has about 350,000 people and a good infrastructure. two of the main islands. One is one city is Port Vila, the other is Santo. They have good healthcare infrastructure. They have about 6 major hospitals, more than 20 healthcare centers. Official languages are English, Bislama, and French. Bislama is their local language. English and French are spoken predominantly, majorly English, because they have been ruled by the British as well as the French at given times.
So Deep,
Very nice country. Yeah. Tell me.
just quick question, because I think this question is really important. So for
Sure.
learners who aspire to be pursue MBBS abroad. So you said
Of
that
course.
frequently spoken language is English. So all our courses, like both of these courses that we have, the medium of instruction would be English, right?
Will be
And
English, yes.
yeah, and learners need not to learn any foreign language to.
No, not
Foreign
required.
language, it is the medium of instruction is English, and the learners to come here, they don't even join this program. They don't have to write any English proficiency test as of now. But of course, if they go to a country to do rotations, another country to do rotations or do their residency, they will have to follow the norms of that country. For example, if they have to go to Canada or US, they that point of time they will need to write TOEFL or IELTS, whichever is applicable.
That's an amazing advantage that we have over other
very
CIS countries, if I would say. Because if
Yeah.
a learner is going to Russia, like any other countries like Russia or Georgia or
Russia,
wherever,
Kazakhstan,
yeah,
Kyrgyzstan,
yeah,
Belarus, Bosnia, Georgia, all have their different languages, and all are Cyrillic
yeah.
languages, which are very different from English. And the problem is that while the course there also is developed, delivered in English by professors, but the moment you go for clinical rotations or any kind of exposure, you are not allowed to if you don't know the local language. These guys, they try to teach you the local language, but again, I mean, in India itself, we know how difficult it is to learn one of our languages where the base is same. Learning a Cyrillic language is extremely difficult, and some students do it, but most students cannot. Hence, their clinical exposure is killed, and hence that leads to that 10-11% passing in the Indian foreign graduate exam. So this is one of the main reasons. And good thing about here is not only we will teach in English and the course medium in English, everybody in Port Vila speaks English, understands English, the patients speak English. So the medium of instruction and the medium of communication is extremely important, and that is a big advantage in this country.
Great.
Do you wanted to add something?
No. That's, I think you have included everything. Absolutely fine. Please go ahead. Because there are some questions which are coming for the fees, and also I think you should continue this presentation.
We will address the questions. Let's quickly go through some 3-4 slides. So maybe some of the slides will address the question, and then if we don't address the questions, we will obviously take it up.
Sure.
Quickly, again, about Port Vila, let's complete it. One of the most important factors is it's a very safe country, very safe city. The police does not carry firearms, and the crime rate is negligent. The country lists on happiness index in the top 3 every year, the UN happiness index. There are mixed people, like there are obviously the Nivan people who are the local people, but there are communities of Australians, French, Chinese, Vietnamese, and British people all over Port Vila. A lot of activities happen here. People really like to go out. They like the sun, the sand, water sports, other sports like cricket, football, basketball. The team of Vanuatu just missed qualifying, going to the qualifiers of World Cup cricket. So this is the overall picture of Port Vila. Let me take you quickly through an overview of UIMS, which is upGrad Institute of Medical Sciences. This institute is incubated under the purview of the Health Ministry, Government of Vanuatu, declared as a national institute of national importance because this is the first medical school in this country. The school is academically integrated under the MOU with Ministry of Health with the National Hospital of Port Vila, which is the Villa Central Hospital. It's a 400-bed hospital. All our clinical rotations and MBBS internship will happen in this hospital. Dean has already spoken about the courses. We will go into a little more detail later. Accreditation and alignment. The institute is approved by the Ministry of Health, by the Ministry of Education in Government of Vanuatu. We are registered with the Vanuatu Qualifications Authority, which is the local framework which allows us to be an autonomous degree awarding institute. ECFMG approval is in process. As I told you, the application is already done and first level discussions are going on, but it is well in progress. We have already received a response from both your WHO and ECFMG that they would be happy to approve an institute here because this region has a lack of medical institutes. MBBS curriculum is aligned to NMC. Curriculum partnership is there with US University, Medical University of South Carolina for the MD program, so that everything is clear with ECFMG approval. We already have a set of faculty, adjunct as well as full-time. I will probably let the dean talk more about this later. Two programs, MBBS program, I think we have answered most of the questions of the MBBS program. Quick pathway again, you come here 4.5 years, you do your studies, including clinical rotations. You write the NMC one exam. Unfortunately, I don't have the answer right now, whether it is online, where you can write it, because the next exam guidelines are still coming in. After you have cleared next one, you can do the 1-year internship at the Villa Central Hospital. And then, of course, we will train as we know more, by the time our students reach the next exam, 4-5 rounds of next exam would have happened, and we will prepare them. We will provide with test series, we'll provide with specialized training for the next exam, ensure that you clear both the exams, as including the next 2 exam, which is a practical based exam. Second program, the Global MD program, which is a 6-year undergraduate program. The +2 students will join in year 1 and do 2 years of pre-med, and then enter the 4-year of MD program. The students will clear 2 years of clinical studies in our partner hospitals. So year 1, year 2 pre-med, year 3, year 4 preclinical with rotations in Villa Central, year 5, year 6 in one of the hospitals of your choice, in a region of your choice, with one of our partner hospitals. After year 4, you write USMLE 1, and only once you clear USMLE 1, you go to the clinicals. After you have done your clinicals, you write USMLE 2. That is where your program ends. You get the degree and you can go into your residency. We will support you with the residency applications as well, and show you the right pathway.
So Dev, so Dev, what I've understood is that learners have, they also have a choice for regarding the clinical rotations. As we mentioned that we are partnering with hospitals in US, Canada.
Most learners would want to go to US, Canada, Australia, New Zealand, but of course they will have to perform well and study well in the first 4 years.
Correct.
To get the choice. It's like any education program. You do well, your choices become wider, and you are given more priority. So
if I am a learner, then I am not only restricted to Vanuatu. If I pursue a global MD, I have options: US, Canada, Australia. These are wide options that UIMS is providing to me.
Yes, there are wide options, and one of the very good question, because we missed this point. All our students who pass either our MBBS program or our MD program will automatically get registered with the Vanuatu Medical Practitioner Board and will get the license to practice in Vanuatu. This is very important because India also asks for it, and many other countries ask this question, whether you have got the license to practice in a country where you have studied. The answer is yes, you will get it. And of course, if you are the kind who likes a nice peaceful life in a good island nation, you can always stay back. There are a lot of jobs available in the hospitals across Vanuatu.
So one of the questions that I can see here is, Dev, that if I do the global MD program at UIMS, would it make me eligible to practice medicine worldwide? Like if I clear the USMLE, and how is it?
Let's put it this way: no medical program in the world makes you eligible to practice worldwide. It doesn't happen. Even if you go to Harvard, it won't happen. Because if you do medical from Harvard, you still run into NMC and you can't register and practice in India. So all countries have their own rules, regulations. Some countries accept USMLE, some countries accept some other standards, some countries like India have their own standards. So what our program does is it makes you eligible to go into any country which accepts USMLE. It also makes you eligible to write exams in countries like Australia, New Zealand, and other countries which accept ECFMG, most of them do. And of course, for the next exam, if you take the MBBS program, it is completely focused towards the next exam. You go back, write the next exam, practice in India. And I have already spoken about how the pathway will be to go to India after the MD program. So I hope that answers that question.
Yes, yes, absolutely. Thank you. Please proceed. Yeah.
Yeah, so quick look at our facilities. I have spoken about Villa Central Hospital, 400 beds, nice hospital, spread out hospital with all most specialty departments.
All
Our
specialties are.
campus- Yeah, so Dean, if you want to just quickly 1 minute speak on the hospital.
Yeah, definitely. Villa Central Hospital is the major hospital here in Port Vila, and it has got about 400 beds, and all the basic specialties and certain advanced specialties are available here. And they've got a very good OPD as well as the IPD, and almost all investigations, the biochemistry investigations or the pathological investigations, they are all available here. A few things which are lacking, they are very shortly they'll also be added. So almost everything that we need for a MBBS program or for their global MD program, for that hospital support, we have in this. You can please go ahead.
Okay, thank you so much, Dean. So let's talk about the campus. So this campus is in the most elite area in the country, not only in the city. On the left-hand side of the campus, there is the Parliament building of Vanuatu, which is the seat of the government. And on the right-hand side is one of the best buildings in Vanuatu, which is the National Convention Center. We are part of that premises, and we have our own area, a big 3-4 acre land area with open area with a nice 20,000 square feet of building already there with options to expand. And as this is one of the testimony how important the government thinks this project is, that they have given a space to start off in a government facility right in the middle of the city in an elite area in Vanuatu. It's a beautiful area. It has a beautiful view of the bay across the island. Accommodation, we have already secured accommodation for students across 2 hotels, obviously separate for boys and girls. There will be, it's typical hostel facility, with bunk beds and and common areas and wardens. So we will ensure that the places are secured. There will be 24/7 security and support for the students. We understand that they are coming to a foreign land far away. So we are the guardians and we will take care of them end to end. Quickly looking at some of the other facilities. Dean, would you like to speak a little bit about the library and labs and digital resources?
Yeah, so the library, in addition to having the textbooks and the reference books for all the subjects that you'll be studying here, we will also be providing you the online licenses so that you can refer to the textbooks or to the reference books through reputed online portals. So these days, the hard copies, as everybody knows, that tradition of going through the hard copies is almost gone. So we'll be providing you the ebooks also, and we'll be providing you with licenses to peruse different journals, which are the important or the reputed journals in different specialties. So our library will be an e-library also, and we'll be having the hard copies also.
Also regarding the labs, guys, this is going to be a modern med school with modern labs. And we are going to, so as I told right in the beginning, we are going to take medical education forward. The issue that happened during pandemic, because of a lot of dependency factors on the healthcare system itself, while everything moved forward, even the school students went online, medical education came to a grinding halt. We want to ensure that situation does not come again. And we want to bring in more and more technological interventions and ensure that there is free flow of study. We are doing away with any kind of cadavers. We will use 3D anatomy table, which with a 3D projection and dissection abilities. We will use synthetic cadavers. So that's a step up which is available only in the highest rated modern laboratories in med schools. We have planned. We are
Can I add 2 lines?
Sure.
Mr. Dev, can I add 2 lines?
Please,
Yeah,
please.
see, we want to do away with everything which is redundant, which is not required in a clinical practice of any modern doctor. So now we have purposefully removed certain things which were in the old labs, which are no longer required. So we are only having smart labs which are absolutely, in accordance with the modern clinical medicine. So whatever you are going to learn here will actually equip you for a modern clinical practice, and we will not overload you with redundant things. That is very important. So our labs are also very modern labs, and you'll be learning exactly what is required and nothing redundant, nothing, we will not overload you with information. So, and whatever I'm telling you, we are not customizing it. It is all approved. There's nothing that we are experimenting here. Whatever we are doing is absolutely approved by different medical councils. So please be rest assured that it will be a very modern kind of teaching and nothing redundant will be there, even in the laboratories.
Great. Thanks, Dean. So as I already told you, we are going through hospital partnerships in various countries so that you get your choice and option of clinical years in one of these countries in a good multi-speciality hospital. Visa services, good news again from Vanuatu. All Commonwealth nations get visa on arrival, including India. And there is a student visa facility here, and we will have a dedicated officer in the immigration department who will handle the visas for our university. We will provide end-to-end support to students for this service. Other ancillary services, we are setting up a cloud kitchen, which will provide known food to students. It will be delivered for breakfast as well as dinner at their hostel, and they can explore options in the cafeteria in the university during the daytime. Transportations will be available from hostel to the college area, though the girls' hostel area is about half a kilometer walk away and boys' hostel is within a 1.5 kilometer range. Still, the transportation will be available and can be availed by students by their choice. Other student services include the entire admission procedure, support with internships, and then career guidance at various stages when you are going to write USMLE, when you are going to apply for residency. We will provide you the appropriate career guidance. While you are in Vanuatu, there will be community engagement initiatives. You will participate in various drives and initiatives which will improve primary healthcare in this country. And our college and our students will get appropriate recognition for that. For knowing more about the admissions process, do reach out to our counselors. Quick highlights: campus immersion. Yes, classes will happen. As Dean said, smart classrooms. You will interact regularly with the teachers who are here and also with mentors from across the world through the smart classroom systems, online classes, online connections. You will be mentored not only by the faculty present here, but from experts from across the world. Then holistic learning, blended learning, very good combination of classroom, self-learning and technical interventions, usage of library and data repository from across the world, usage of modern facilities. You can see the 3D anatomy table here. Early clinical exposure, which is a very, very, very important point and something that only we are offering right now, being one of the most modern medical college setups in the world. We will usually, the clinical exposure starts from year 3 and it is very much limited because of availability of hospitals, doctors. It's one of the challenging things in medical education, especially in the CIS countries where language is a barrier. What we are doing is we are creating our own dedicated portal with one of our telemedicine partners, where from year 1 itself, students will start being part of diagnostic conversations, the patient interaction, and they will get the exposure from year 1, which usually comes in year 3. They will also, from year 2, they will be able to see complicated procedures happening live in various surgery rooms across the world with a narrator telling them what exactly is happening. So this is also they can see it live or they can see it recorded, both the telemedicine sessions as well as the surgery rooms. While they are graduating in their program in the senior years, we will give them AI-enabled digital patient access where they can talk to the patient, practice their diagnostic skills, practice their bedside manners, and get ready for the physical world even before they have stepped into the real world hospital setup. So as you can see, the focus is to make you ready for the real world as a doctor, rather than just degree and exams and studying theory. We want to prepare doctors who can be effective in the real world scenario from day one. And that will end up making you good doctors, opening up world of opportunities for you, and also impacting the healthcare of the world in an overall landscape.
So Dave, one of the questions that I can see in the Q&A is that, because it is interrelated to what you were mentioning. So you said that you talked about the technical interventions that we are providing. So one of the questions that somebody is asking is that, what are the advantages that UIMS has over and above DCIS countries? So like if a learner pursues MBBS from any of these CIS countries, what are quick advantages that UIMS have over and above? One, I understand it's the language thing that is there.
Quick
Second, that,
highlights.
yeah,
Yeah,
if you
quick
and Dr.
highlights,
Lal can talk about it. Yeah.
Yeah. So, Dr. Lal can expand on it. Let me give quick highlights. One is definitely language, interaction with patients. Second is training for the licensure exams, whether it is Indian or USMLE. The third one is being part of a country which is allowing our medical school to be part of their fabric, their government, getting involved in community services, and actually improving the primary health of a country, which is not allowed in any of these other countries. And finally, from my side, the blended learning model, which exposes you from very early stage, not only to the theory of medicine, but what you will do when you actually get on the floor in a hospital. Let me tell you my experience. I have experienced the COVID fight very closely in UAE. And even in a small country like UAE, we ran out of doctors, and we brought in fresh medical graduates from places like Georgia and also India. And there was a difference of like a world between them, because the students from these countries, they didn't know how to talk to patients. They have never done procedures. They were clueless. They were clueless on the floor. And that is when we got the seed of this thing, that we will have to deliver medical education differently, because the world is different now. And we will have to ensure that the fresh medical graduate, forget fresh medical graduate, anybody who has been trained for 3 years and going for clinicals, they know what they are doing when they enter the floor. And that is what is the most important thing for us. Very few colleges in the world have customized themselves or have calibrated themselves to address this problem. And we are going to be one of the first. Dean, please add.
Yeah, sure. In fact, no, this is very important, the early clinical exposure and proper clinical exposure. Because I have been, almost 4 or 5 countries where I've worked. What I see is that students are still struggling, even in the 3rd and the 4th year, they are struggling to get a clinical exposure. So, this AI-based thing, the digital patients that you see, you are not only getting an early clinical exposure, you are also getting trained for the OSCEs. The objective structured clinical examination that you have in different medical councils all over the world. So after you qualify the written examination, you have to go for OSCEs. So we will be, in fact, indirectly preparing the students even for the OSCEs. So early clinical, the keywords are early clinical exposure and adequate clinical exposure. So we'll be providing both of them, which is actually very important. Your hands-on skills are very important for a doctor.
Yeah. And so I would say that and I would say that this is really, really important, because one of the criteria that I was reading under the gazette issued by National Medical Commission about next step 1. So they were saying that unlike what we used to have in FMGE, like it is like this is just to bring uniformity for Indian learners also who want to pursue in India, and for people who are coming from abroad, both of them. So in next one, they're saying that it is more to do with testing your practical skills, and also not only restricted to you writing long answers. It will be totally based on MCQs. So if we are getting, you are getting this kind of exposure and clinical exposure from day 1, then obviously you have that kind of understanding. Even if you're answering the theoretical questions, the minutes of all the like the terminologies that you mentioned. So yeah, that is there. So this will act as
And
an advantage.
finally, Harshita, we are giving the students an unlimited playground. The students who really want to do well and learn well, they can, there is no limit to how many telemedicine sessions they can attend, live or recorded. There is no limit to how many surgery room videos they see. It is all depending on how much effort they are willing to put in. The playground is there, the system is there for them, and it will keep on expanding. So finally, medical education is also a thing which is as much dependent on the student drive and interest as much it is on the institute. We as an institute can give them all the facilities, from their side, we expect complete commitment to this program, and we can assure that if they do that, then they will be a different brand and different breed of doctors, the modern ones who will come out in the next 5-6 years.
Just
So,
a very small, just a
yeah.
very small addition to that. When I said adequate clinical exposure, it's not only the hands-on skills, it is also the soft skills. The more you interact with a virtual patient or with the actual patient, your soft skills are also honed. They become more sharp. And what we need is, doctors with very, very good soft skills, communication skills.
Yeah, absolutely,
One
absolutely.
small
So
point regarding the exams also, Arshita, while next is definitely a positive step in India. And to be very honest, they are aligning themselves with USMLE, if you look at it that way.
yeah,
It is exactly same as what they do in USMLE. Only difference is they do 2 years of clinical before writing between USMLE 1 and 2. Here for us, it is 1 year because we have 1 year extra studies in theory. And they have to write next one, do internship, which is the residency part, and then they go and write next two. And we have not seen next exam till now, but I can tell you the format and the execution will be exactly like USMLE. That is what we are aligning to right now.
yeah. So we are running a little bit short on time. So yeah, but all the learners who
There are
have
a
joined.
couple of slides, and one slide will answer a lot of questions because it's regarding
Sure.
the fees.
The
So
fee,
let's run through that.
Yeah, I just wanted to add one point here. I just wanted to add one point to all the learners. We will be sharing the links for the social media and also for links for the WhatsApp group. So even if your question is not answered here, please feel free to drop your questions in the WhatsApp group and we'll assist you with all the answers. Yeah. Thank you.
And don't worry that you don't have access to us. You can come for video conference sessions with our counselors, and we will also be part of these such video counseling sessions periodically. So we'll be happy to answer all the questions even then. Quickly, just I wanted to show you there are a lot of academic people here involved. Quickly, I wanted to show 3 of the main people because I also wanted to show the diversity. Dr. Krishna Bhatt is from US, part of University of South Florida. He's our chief academic advisor. Dr. Bhatt, you are already interacting with. He has 20 years of experience with Indian Armed Forces and 10 years of more than 10 years of experience in teaching students from across the world, including Caribbean, South America, Mauritius, South Africa. Dr. Santa Muller has spent 12 years in South Pacific, specifically with both universities in Fiji, setting them up right from grounds up. So she's traveling, unfortunately, or would have invited her also to be part of this session. So she is also there. So we are making it truly global, right from advice from US to South America, Caribbean, Middle East, India, and South Pacific. The 3 leaders cover everything. Quickly looking at the advisory board, Ronnie doesn't need much introduction. He's the chairperson of the advisory board as well as upGrad. We've got Dr. Krishna Bhatt. I spoke about him. Dr. Ambassador Robin Nair has the distinction of being in foreign services in 2 countries, Australia and Fiji, and he's a barrister and he's given us very good advice for the local level execution. Dr. Girdhar Gyani is again a very well-known figure in Indian medical industry. He actually is the one who designed and launched the NABH framework, which all hospitals in India have to follow. He is right now Director General of an association where 21,000 hospitals are registered. A very experienced person, has worked deeply with the government of India for the healthcare quality framework. We are very lucky to have these people on the advisory board. some of our adjunct faculty, maybe Dean, you can take over for 2 minutes here and talk more about the local and adjunct faculty.
Yeah, so you can see, I need not highlight each and every one, but you can see, different specialities being covered in our adjunct faculty. They are very, very reputed doctors. They are big names in the respective countries that they are, they are practicing, whether it is physiology or ENT or medicine or neurology, community medicine, disaster management, cardiology, gynecology. We have all the specialties which are covered in our adjunct faculty, and not only the teaching experience, they've got a vast clinical experience behind them. So this is our adjunct faculty, and if you can just go to the next slide.
Yeah. No, this is it, doctor. So
okay. So main faculty, definitely, we already have a lot of about 4 or 5 who have already joined us, and they are also in the process of joining. So obviously the full-time faculty will come as per the requirement. So as of now, we are actively recruiting for the basic sciences, the basic medical sciences, anatomy, physiology, biochemistry, and already 3-4 have already joined. And these are all teachers, who have got almost 10 to 30 years of experience behind them. So again, they have got a clinical experience and they've got a teaching experience in international, very reputed medical schools. So that is about our full-time faculty.
Before we go into the fees, which is the next slide, and will answer most questions, quickly covering the regions here. Yes, from this college also, when you go back to India doing it, you have to write next exam. Yes, you can go to Europe, to the countries which recognize and accept USMLE. I can't get into every country and every framework. A little bit of research from your side would also be great. Or reach out to our counselor, they will help you with it. Can you go to UK? Yes, you can go to UK, but UK also has GMC, which is the General Medical Council, and you have to write their exam, very similar to like Australia. But you will be eligible to write the exam going out from an ECFMG college. One person has asked a very interesting question about research. If you want to do research, yes, you can do research. Quickly, our deputy dean actually has 30 years of background in research, and she will set up a separate research department. You will get the opportunities. You will get the material, you will get even good research projects selected by the college will also be funded. So research will definitely be one of the focal points of this college. Right. So without further ado and going towards the close, let's look at the fees. This is important because our MBBS fees is $9,500 per year, $4,750 per semester. And MD fees is $14,000 per year. We are giving a special opportunity to students who are coming into our first batch, and there is a substantial reduction in both fees as scholarship opportunities. To know more about that, you please do reach out to our counselors. But let me tell you that these are limited. There are limited seats and there are limited scholarships. So reach out, apply, upload your documents, and we will provide you the best financial option to come to this college. First year, we insist that you live with us, you stay with us, because you will be new to this area, young people. So the living cost is about $7,000, which covers hostel and food. And apart from that, from second year, I'm sure the students will enjoy where they stay and they will continue. But if you do need an option and you think that you can do well, why not? We will be happy to support you in any way that we can. So 25th July, please apply before that so that we can have enough time to talk to you, to know you, to provide you with the right information and scholarship, and get your visa done. 18th September, the batch starts in Vanuatu, and I'm looking forward to see many of you here. Somebody has also asked about PG programs. I'm sorry, right now for this session, we are not starting with any PG program. Maybe we will start with in a couple of years and in some other campus, because this is a 5-campus model. We are starting with Vanuatu. We will go to Fiji. We will go to Australia. We will go to Indonesia, and that all information you will keep hearing in future times. One more important point that I wanted to cover, which I'm sure we missed earlier. The MD program we are starting right now is for +2 students specifically. So you come into the pre-med and then you go to the 4-year MD after 2 years. From January, we will start a special batch, which will be the direct 4-year MD.
Direct entry, yeah.
This will be for students for outside India or India. You need to have done 4 years of graduation. And with a bioscience component, we will take all your documents and we will verify your credits. And we will give you direct entry to the 4-year MD program. You need not do the pre-med part if you have already graduated and with a bioscience program. So, but that batch will start from January. So I think I have provided all the information from my side. Dean, if you want to add something, or else Harshita, you can coordinate on the Q&A.
Yeah, I think we have covered almost everything. So now I think if we have some time, we can concentrate on the Q&A.
I think we can answer 1 or 2 questions and not more than that. So I think most of the questions are already covered here about UK, then Europe, and then about the research. So if I think we can close now, and if learners have any further questions, they can reach out to us through the WhatsApp group, and we can answer the questions there.
There is somebody called Arjun Reddy who wanted to speak to the upgrade officer, but he's no, I don't see him here anymore. So maybe we can reach out.
Sure.
Sandhya Yadav is raising hand. If she still is interested, maybe we can take a quick question.
Yeah, sure.
Okay, I think Sandhya.
Yeah.
No problem. I think we can take it on the WhatsApp group.
Okay.
So, yeah, so in closing, we at upGrad, we extend our warmest gratitude to all the participants for joining this transformative webinar. And also I would like to express my heartfelt gratitude to both of our guest speakers, Dr. Lal and Dev, for enlightening us about the medical education. And as we conclude, we want to emphasize that UIMS, which is upGrad Institute of Medical Sciences, we welcome both kind of learners, NEET qualified and non-NEET qualified students, ensuring an inclusive learning environment for all, and with comprehensive medical opportunities and clinical rotations and a global perspective. upGrad Institute of Medical Sciences equips aspiring medical professionals with the skills and experience needed to excel in their career. So thank you everybody for your participation, and we look forward to accompanying you on your path to excellence in medicine. Thank you so much.
Thank you. Thank you, Harshita. Thank you,
everyone.
Thanks to Dean.
Thank you. Thank you, Sudhir. Thank you, everyone. Bye.